I want to give you the fake manufactured clap for a sec here, okay? And it's a sincere one. I'm going to tell you why, Congressman. I've been giving you props over the last few weeks. You are the number one defender of Arizona's reality of any elected official out there. I don't know why it's so hard for the rest of the Republican leaders in Arizona to come out and do what you're doing. But if you want some reality, go hang out on, usually, Twitter is a black hole of crap. Go read Andy's Twitter feed, because there's a lot of good stuff in there. So tell me the reality of that battle right now, sir.
Well, the reality is, I think people's eyes are opening up. I mean, I do not truly understand this idea that we have to be in panic and hysteria all the time. I mean, you look at the number of tests, our tests are up. You look at the number of positive detections, those are up. But you look at who is getting those. It's age 20 to 44. That is who is really. They're well over half of our positive tests. But when you start looking at it, you say, well, but they don't get sick so much, and their case fatality rate is 0.02%. The hospitalization rates in Arizona are declining, as are the case fatality rates. You look at like what you guys were just talking about. So when people say, "Oh, our ICU beds are overdrawn," well, you know what? They're about 85 to 90% at any one time, and that's exactly what it would normally be. But if you take a look at it, something like 55% of those right now, and I didn't check this morning, but 55% of them are COVID related. That means that 45% of those beds that are being occupied in ICU are not even COVID.
All right, so I want to make sure I got this straight because you went pretty fast there. One, hospitalizations are down over what kind of time period, Andy?
The rate itself has declined for the last 35 days.
Okay.
The last 35 days. Think about that. In the last 35 days, the governor came out and imposed a don't go to bars, don't go tubing down the Salt River or anywhere else, don't have any fun in public. And all those were designed to lower the positive detection rate amongst age 20 to 44.
Right.
But that's the age group that survives this very, very well. I mean, I saw a great meme yesterday. It said, imagine this, a virus that is so serious that you have to be tested to know that you have it. And that's really what's happening in that age 20 to 44 category.
Now, let's talk about Dr. Demented, as I call him, Dr. Fauci, and the scarfed one. There has to be other, and there are, right? So we got this. There's this guy, Dr. Ionitis, out in Stanford, right? Yeah. He's like the kick-ass virologist guy. He called this in March. He called this what this was going to be in March. And he's ignored, and Dr. Demented and the Scarfed Wonder keep spreading panic throughout the world. How does the president? How do we get a hold of this thing? Because aren't there other people we can talk instead of Fauci, for God's sakes?
Yeah, there are. I mean, Ionitis is one. Atlas is one. I mean, it isn't just one anymore. I am contacted weekly by doctors. I talk to doctors regularly. We did a roundtable on. For House Freedom Caucus last week with I think it was 5 or 6 doctors talking about these issues. I've been trying to do the alternative because Fauci and Birx get all the media attention, but there are hundreds, if not thousands, of doctors that contradict everything they say. And by the way, you can actually take Fauci and Birx's own statements, and they contradict what they say. So we are trying to get that message out there because it is actually fairly widespread that Fauci and Birx are wrong, and I've begged the administration withdraw them, pull them back, anything. But they've become media darlings from the left now, so that becomes a hazard in and of itself politically.
I mean, Fauci is to me such a dishonorable guy. So when I was watching Rand Paul question him at that Senate subcommittee, and he kind of says to him, he goes, "You just shoot your mouth off. Oh, we're not doing baseball. We shouldn't do football, blah, blah, blah." And then Fauci's like, "Well, no, I don't really say that. They just kind of asked me." You're like, bullcrap. You just said they're probably not going to should be football and NFL football in the fall. And you're like, I'm so sad. I don't know how if Trump said, "I'm going to get rid of these two and take Ionitis and someone else who's really good and replace them," I think he's better off doing. I think the president's been way too quiet in the last 30 days on this issue.
Well, he's been out there talking, but every time he says something, because the president wants to be optimistic, I get that. But when the president tries to say anything about, well, the death rate's gone down, then Fauci will get in there and say, "Oh my gosh, we're going to have 100,000 people a day, new COVID cases a day," and it isn't like Fauci's right on anything. I mean, the president actually said a few days ago, he said, "That guy's been wrong a lot. He's made a lot of mistakes," and he's right. But he keeps getting out there. The thing about Fauci is, even if the administration doesn't roll him out, he feels that he has the prerogative to go speak to every media outlet, and he does, just throws these one-liners out there. Yeah, no football, no and when you push him like Rand did and said, "Look, what do you got? Do you have any evidence about it?" Well, no, I don't have any evidence about it. I'm just speculating, because that's what he does. He speculates.
Again, this is why when we keep having all these conversations, how is America supposed to respond to public health decisions that are based on people who keep saying two different things, mask, don't mask, so, all this different stuff. It's an impossibility, and that's why politics is ruling and not logic.
That's right. And that is I got to tell you, that is the biggest problem that we're facing, is that politics is driving this and not the data and science. I mean, even the World Health Organization last week, don't know if you saw this, but they pulled back on everybody must wear a mask. They said, "Look, we get it. If you're outside, if you're doing anything of exerting effort, you shouldn't be wearing a mask." Why is that? Well, because mask cuts off the oxygen that you can breathe and increases the CO2 level that you're breathing in. And when Fauci talks about masks, he doesn't talk about the literally 100+ studies that have been done on masks, and just very few say that any masks work, and it's only the N95 that works. But you know what? He himself, every once in a while, he lets the truth slip out. He let the truth slip out about a month ago when he said, "Yeah, you wear masks as a symbol." That's really what this has become, and so now we've got mask shaming going on. You don't wear a mask. Oh my gosh, don't you care? I had someone, I'm all by myself in a back hall in an airport. There's nobody else around me. Somebody pops out of an elevator. They're 10 feet away from me. I'm not wearing a mask. I've got my mask ready to put on because they require it to get on the plane. And I'm literally by myself, and they say, "Oh, thanks for wearing your mask." And they start trying to mask shame, and I just smile because I feel bad for them believing folks like Dr. Fauci, instead of looking at it and saying, what did the science say? Nobody else has time to look at this, but there are literally literature reviews that would summarize all that. You could go get that. But the point is, ultimately, Fauci has undermined the credibility of the public health apparatus in this country.
A listener just wanted me to verify something you said earlier in the first segment about that the ICU, the occupied beds at ICUs right now are pretty much traditionally where they're usually at that 80-90% level, even without COVID?
Yes, that's right.
Well, that's something else that's not getting out. How about that for crazy?
Yeah, well, how about this one? They freak out about the emergency departments. We're about 50%, and sometimes most of the time over the last 5 months, we've been less than half of our ED beds have been full, and we're sitting about 50% right now. And the most people we've ever hospitalized in a day, at least as of Saturday when I checked it. Last time I checked the data was on Saturday, and this is Arizona Department of Health Service reporting, was 106, and that was 3-4 weeks ago. Do you know that we've been discharging 400 to 500 people a day related to COVID over the last 2 weeks?
So I mean, the highest hospitalization intake day on COVID was 106?
Yes, and we've been discharging the last bit about like I say, 400 to 500 a day. So, so, so you've got all this panic is based on one number taken out of context, and so
what number is taking out of context?
They're taking the number and they're saying, okay, our positive test result rate,
right?
Not rate, but the actual number of cases that are positive test results. So, like today, there'll be a report. Don't be surprised if it's 4,000 people or so, a new test case, because that's going to include last Friday, Saturday, and Sunday. That's going to come out, and they're going to say, see, 4,000 new cases, right? Wow. Well, what about all the discharges? What about all the recoveries? What about the people who were asymptomatic? All of this needs, the powers that be are not giving us the full context. To their credit, there's a whole lot of information on the dashboard you can get, but it's not being reviewed by the media.
So tell me the pressure on Doug Ducey to deliver Trump and McSally in a battleground state and how that affects how he handles this. Because that's my number one thing, because I wish Doug would say half the things you're saying. So give me the political reality of what he's living with.
Well, the left is beating the heck out of him, and the base is beating the heck out of him. So you got the base saying, why aren't you out there talking about the data and being stronger? And then the left is coming out, and Sinema is saying, people are going to die. We can never open schools again. But that type of thing. And it's not just her; it's the left-wing media in large part. But the point is, they're really pushing Ducey. Ducey's feeling the heat. And in my opinion, you have to constantly be out there talking about what the context of everything is. And there's studies now that are really clear that say the lockdowns are worse for public health than the COVID is. You'll have more deaths resulting from everything from suicide, drug and alcohol problems, to the cancers that are not being treated. We went a period of time where half of cancer patients were not getting chemotherapy. Why? Because they were afraid to come in. They were told not to come in because they had a weakened immune system. So the cancer doesn't stop growing just because you've got this virus going out there. These people need treatment. Then you have cancers that are basically going undetected. You have no vaccines going on. The public health crisis that we've created on the other side of this thing that nobody's talking about is actually going to have, according to some studies, a more dramatic effect upon us than the COVID.
I was just looking at the New England Journal of Medicine on Iceland and some of these other countries opening up their schools and how there is no coronavirus bump or danger on that. Are we ever going to get that logic over on this side of the pond, as they say?
Look, that's what my roundtable was on last week. These guys brought out data like you wouldn't believe. It is safe to go back. These kids, first of all, they're not super spreaders. So these young kids that are in school, they're not going to, if they were to get COVID, they're not going to take it back and spread it. They just don't seem to be contagious. They don't get it. They don't get COVID very often, and it's really extraordinary for that to happen. So these other places around the world, it isn't just Iceland. A lot of them are opening up. There's no masks. There's no plexiglass. There's no social distancing. They're opening up school, and they're not seeing the dangers in this coronavirus. But the fact that I say that, people say, "Oh, you're nuts, Biggs," blah 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 blah. You know what? There is plenty of data. There's plenty of science out there. There's lots of experts on this that are talking about this, but their voice is being drowned out by the hysteria and panic engendered by folks like Fauci and what have you.
We only have 1 minute left, so I'm going to give you a big question to answer in 1 minute. The quashing of medical opinions that does not conform to the narrative is one of the most disturbing things I've seen out there. What can the average person do out there to kind of change that balance?
I don't know that we can necessarily change the balance, but I tell you that there are people that are experts on this. There's a great journalist, Alex Berenson. He writes a lot. He tweets a lot. This is what he did for the New York Times. He did medical reporting, and he reports on a lot of this stuff that's out there. Then you can always go to Doctors Atlas, Ionitis. You can follow my Twitter. We try to link up whenever there's studies. There's lots of studies out there. The problem is most people don't have time to do that, and they get in a one-sided presentation, and that there's so much information on the other side.
Andy, thanks for a great discussion. Keep up the good work, sir.